Thank you. We're really excited that you all are here and that Dr. Disha Mookherjee is here with us to present to us tonight how to find some heart coherence. Disha is a board-certified cardiologist with Saratoga Hospital who likes to deal with all matters of the heart. She's the founder of the Path to Meditation Mastery, the Chopra Center certified primordial sound meditation teacher, and Heart Math certificated in stress, anxiety, and emotional management. Thank you so much, Disha. Take it from here.
Thank you. Can you hear me okay now?
Can hear you great, yes.
Okay, awesome. So thank you so much for asking me to talk about a topic that is very near and dear to my heart. And, when we talk about the heart and the American Heart Association, and every single day we're talking about know your numbers and eating a healthy diet and exercise, and all of that is so very, very important. And I talk about that multiple times a day with every single patient that comes in. And but over the last decade that I've been a cardiologist, and prior to coming to Saratoga, I was a cardiologist in Minnesota, in Duluth, Minnesota, and I was director of the cardiac rehab there. And one of the things that I noticed was here we work together as a team, always as a team, taking care of patients who've had stents, who've had bypass surgery, who've had other heart surgeries, and they're coming to cardiac rehab. And I always am reminding them that, look, your heart is not fixed, right? The stents are a Band-Aid. The bypasses are a Band-Aid. The true healing comes from the inside. And when these patients would come in, there was this elephant in the room that no one was really addressing. It's like you just went through, I like to say, an organized train wreck by your body's going through it. And we didn't do this so you could go home and be pissed off at your spouse. We didn't do this so you could sit and worry about your bills all the time, right? And yet, I think that the stress of all of it plays a huge role. And when it's not addressed, we can't really heal. And so when I became a physician and a cardiologist, yes, I've had influences. My dad's such an inspiration, being a cardiologist, but I became a cardiologist because it was an organ that I understood the best in medical school and it made the most sense. But I also became a physician to help heal patients. And I realized that, yes, I'm giving medicines and I'm, sending people to the cath lab and to the OR, and yet a lot of these patients aren't healing. And what is it, right? And so when I came across heart coherence and stress and meditation, I realized there was a piece of the heart healthy puzzle that wasn't really being addressed that needs to be addressed. So let's keep going. Oh, hopefully this worked. There we go. So of the 10, this is from our former old Surgeon General, of the 10 leading causes of illness and death in the US, 7 could be greatly reduced if the following lifestyle habits were modified: alcohol abuse, lack of exercise, poor diet, smoking, and unhealthy maladaptive responses to stress and tension. So when we're talking about stress, stress can be defined as a state one experiences when there is a mismatch between perceived demands and our perceived ability to cope. Stress can be acute or chronic. So here's the thing, our stress response is super duper important, right? We need it. When we were cave people in the jungle and the tiger was chasing us, we need that stress response, that fight or flight response, so we could run like crazy and get away from the tiger or fight it, right? And so that's an acute stress response. But our bodies weren't created to be in that fight or flight, running from the tiger, running for your life for 24 hours a day, 365 days a year, for decades at a time. And what's happened is this chronic, there's a lot of data out there for chronic stress and its impact on our heart, right? So stress can cause increased platelet stickiness that can cause our brain attacks and heart attacks. Type A behavior, right? If you're a type A behavior, depression, anxiety, hostility, stressful life change events have all been linked to heart disease. Stress causes increases in abdominal fat, which secrete inflammatory cytokines and promote insulin resistance and cardiovascular complications of metabolic syndrome. Right. And we also have data that shows that stress can lead to AFib and VFib, ventricular, these dangerous rhythms of the heart, stress-induced cardiomyopathies and broken heart syndrome. And this third point here is really key because I think stress contributes to and or aggravates the standard Framingham risk factors, which we are so familiar with, of cholesterol, smoking, and hypertension, as well as diabetes and obesity. So we've been really great at targeting all of those risk factors, but here's the big elephant in the room that we're not really addressing as much. And stress can precipitate and or worsen congestive heart failure. I see it every single day. And really, 70 to 90% of all visits to healthcare providers result from stress-related disorders. And what are some of our warning signs? Loss of focus and mental clarity, lack of ability to relax and sleep, loss of self-esteem, feeling tired, and being on edge or angry. Right? Who's felt that way before? We throw out, especially when we're sitting there with our computer on all day, all night, right? There's actually been this study done where they looked at almost 1,600 heart patients. What happened the 2 hours before your heart attack? And those who were super angry, they had an increased risk of MI or heart attack by 230%. And this is something that I saw a lot in cardiac rehab when we're looking at depression. 75% of post-heart attack deaths are related to depression in the next 6 months. And these were independent of other risk factors. And those who have depression and heart disease don't do as well when they have surgery. They have a 2-fold increase in outpatient mortality, a 5-fold increase in death after a heart attack, and they tend not to follow through with nutrition, exercise, and medication recommendations. I just had this conversation today with the patient in the office. She's like, well, how's my heart? I said, well, you know, I can tell you the X, Y, and Z, and you need to do these things, but if you're just like, well, who cares? Doesn't matter. My kids are all in bad relationships, and that's all you're focusing and thinking about all the time, you're not going to follow through with all the things that help all those risk factors we're trying to modify. And so what is the stress response? You have an initiating event. You have perception of that event, so you perceive it. You have a response to it, and then based on that response, there's an effect, right? So something happens, and you perceive it in a certain way. We're going to get into this a little bit more. So you see things, I love this quote, it's from Eric Butterworth from Spiritual Economics. You see things not as they are, but as you are. Your perception is shaped according to your previous experiences, your faith, and according to where you are in consciousness. More important than changing the things out there is changing the way you see them. And this is a hilarious picture to me. Perception is everything. This gal on the left is absolutely terrified. Look at her face going down the roller coaster. That's me on top of the roller coaster for sure. And the gal on the right is having the time of her life. She's ecstatic. She's so happy. And so one event can happen, and the way each of us perceive it can be so very different, right? And so over the last 20 to 30 years, there's been researchers and clinicians who've been exploring and revealing the powerful wisdom of our hearts. The heart and the brain communicate and work together to regulate emotional and cognitive responses. So when we were in our mother's womb, we can perceive and we can see on an ultrasound the heart beating at 5 weeks, 5 to 6 weeks gestation. On a close-up transvaginal ultrasound, you can see that. And it starts beating and working before any of the other organs are formed. Okay. Heartbeats are not simply electromechanical pulses, but they actually represent an intelligent language to which our entire being responds. Variations in beat-to-beat changes in the heart rhythm patterns affect information processing, feelings, and creativity. And the heart has its own nervous system. They actually have a term for it called the heart brain. The heart sends far more information to the brain than the brain sends to the heart. And this is something that we can relearn how to do, which we're going to do in a little bit. But our brains have gotten so used to being in fight or flight and running from the tiger and sending those signals down that we've short-circuited our communication from our heart to our brain. And patterns in neural signals from the heart especially affect the brain centers involved in perception, emotional experience, and self-regulation. Which brings us to the heart rate variability, the heart's rhythm. So even all of us, most of us have a normal heart rhythm. And obviously we deal with other heart rhythms in cardiology as well. But just in a normal heart rhythm, when you look at the beat to beat variation, there is a little bit there. And this is something that's been studied for years and years and years. The heart rate variability, the beat to beat variability. And it's a key indicator of autonomic function, which is our parasympathetic nervous system. When we're in fight or flight, our sympathetic nervous system, our stress response is turned on. When our parasympathetic nervous system is turned on, that's our autonomic nervous system. It's our autonomic function. And so when we have a low heart rate variability, there's not a lot of variation in between those beats. That indicates a high sympathetic and parasympathetic tone, which is associated with high cardiac risk. And when our heart rate variability is high, we have a lower cardiac risk. And our heart rate variability decreases with age. And a low heart rate variability is predictive of heart attack and sudden death. So what is coherence? Okay. So we're going to talk more about that. Coherence is an optimal state in which the heart, mind, and emotions are operating in sync and balanced. So when you look at this picture on the right of the screen, you see the regatta rowers, right? In order for that boat to go forward, all the rowers have to be in sync, right? If one guy's rowing slowly to the left and the other one is rowing to the right, it's just not going to go anywhere. In order to win that race, we have to be coherent. They all have to work together, okay? Another visual that I like to talk about is like if you just picture a piece of paper that has a whole bunch of scattered dots on it, right? When you bring those dots into coherence, they line up. And when the heart is being coherent, the heart rate is coherent. It's the prime enabler of behavior change. And unmanaged stress all over the place is the prime disabler. Being in coherence helps us build resilience capacity and energy reserves. And so when coherence within and amongst a system implies connection, structure, harmony, alignment, and integration. So whether it's in cells, tissues, organ systems, individuals, groups, and societies, every whole has a relationship with and is a part of a greater whole, which is part again of something greater again, right? So in this context, nothing can be considered as separate, alone, or lacking in relationships. And I think that's something that's happened in our modern medicine with our specialization in the different organ systems. We forget that they're all connected, right? And so many of our cardiology consults that we get in the hospital is like, somebody's heart's going fast, fix the heart. It's like, hold on. Did we look at the whole body? Does the person have an infection? Or is there something else going on? Because the heart responds to what is going on in the body. The heart reacts to what's happening because it's all connected. And that's why also as cardiologists, we have to go through internal medicine training because we have to understand the whole body. But and we have to try to get it back into coherence. So improving coherence in one system can also increase the order in other connected systems. So what is this heart coherence? So if I put a little sensor on your finger and I mapped out the beat to beat variation, the heart rate variability, okay, it's going to give me a little graph just like you see here. So on the left, you see heart rate variability in coherence when a patient or a person is in that place of negative emotions, frustration, irritation, anxiety, worry. You see these jagged lines on the left side, right? When you have this incoherence happening, it inhibits brain function. It impairs performance. I think of road rage as a great example, right? Somebody gets really angry. They make poor decisions because this frontal lobe, which is our decision-making center, is not functioning optimally. But when you are in a place of positive emotion, appreciation, love, caring, and you put the sensor on your finger, you can see this beautiful sine wave that you see on the right. And when we're in coherence, it facilitates our brain function and it promotes optimal performance. So our heart rhythms directly affect physical and mental performance. Heart signals affect the brain centers involved in decision-making, reaction times, social awareness, and the ability to self-regulate. Like there are professional basketball teams that practice heart coherence before they get on the court so they can optimize their reaction times. There's so much data based on this. So again, when there's incoherence, it inhibits brain function. Coherence facilitates that brain function. And so this brings us to these key concepts of stress, emotional regulation, intelligent energy management, and resilience. So self-regulation. So there's research consistently shows that self-regulation skills are necessary for health and well-being. What is self-regulation? It's the ability to act in your long-term best interest, consistent with your deepest values, really being authentic with your deepest values. Emotional self-regulation is the ability to calm yourself down when you're upset and lift yourself up when you're down. If, like most of us, you can stand to improve self-regulation skills, a good place to start is understanding the physiology and function of your emotions. And so stress, transforming our stress, okay, we can do this. Stress affects the body physically, mentally, and emotionally. We all know that. You know that in your heart. It speaks truth. But we can learn to flow through life stresses and challenges more successfully and effectively by developing self-regulation skills. I started doing this with my older daughter. She was she has big feelings. Big feelings. She can't be first on the playground. Woo! Watch out. She's throwing herself on the ground. And we're like, oh, sweetie, you got big feelings. We need to talk with this feelings doctor. And so it's all about transforming the stress, right? And many of us have not been learning that since we were young because the people we were around didn't know how to regulate this. But it can be taught. So this is a key point. It is not the event or situation that creates the stress. It is not the event or situation that creates the stress. You're like, what are you talking about? I can tell you why I'm stressed. It's because of that person, that person, that person, that person, right? It is not, let me say it again, the event or situation that creates the stress. It is how we emotionally respond to a stressful event that then has a powerful impact on mind, body, and spirit. So Heart Math teaches the Heart Coherence technique, which helps us to regulate how we respond emotionally, physically, and mentally to stress. So transforming stress and developing self-regulation skills leads to enhanced resilience capacity. And what is resilience? It's the capacity to prepare for, recover from, and adapt in the face of stress, challenge, or adversity. As you build your resilience capacity, you are building and sustaining your energy reserves. And so we have domains of resilience. We have physical flexibility with endurance and strength. And then on the left here, we have mental flexibility, which has to do with our attention span, our ability to focus, incorporate multiple points of view, and tolerance. We have emotional flexibility. Can we have a positive outlook? Can we self-regulate? And then our spiritual flexibility, where we are committed to our values, right? We know we should be eating healthy, but we're eating a bunch of junk food. Is that in our value system? Or we know we should be listening to something that builds us up, but we get sidetracked by the toxicity of what's going on in the news, maybe. Tolerance, spiritual flexibility includes tolerance of others' values and beliefs, okay? And so it's a matter of reframing perspectives. And so when our autonomic nervous system is in imbalance, we have this stress response, we have a relaxation response, and we want to focus on lowering our sympathetic nervous system arousal. And when it comes to energy management, we want to stop the energy drain of depleting emotions, or sometimes I've been taught this word called waste thoughts. Wasting, it depletes our energy. Thoughts that just recirculate. We have 80 to 90,000 thoughts going on in our head every single day. 90% of them are the same thought over and over again. That equals a waste thought, okay? And it depletes us. Energy management has to do with recharging our batteries, with renewing emotions, enhancing self-regulatory capacity, and building resilience. And so what are our depleting emotions? Go along with depleting thoughts. I teach this in my meditation all the time when I'm teaching meditation. But emotions such as fear, there's been a lot of this in the last year. Frustration, impatience, and anger have a toxic feeling and cause the release of the stress hormones that results in, of course, all the cardiac complications, but reduced muscle mass, brain cell death, impaired memory, accelerated aging, impaired mental function, and diminished performance. My sister and my dad are on this. You know, we are helping to take care of my mother who has dementia. And we all know that she had a lot of depleting emotions going on in her life and a lot of waste thoughts circulating, of a lot of same thought over and over again. And at least for me, I have no doubt in my mind that has played a role in her dementia development. And then what are our renewing emotions? Emotions and attitudes such as care, courage, tolerance, and appreciation create neurochemicals that regenerate your system and offset the energy drain, which results in, there's actually data on this, increased longevity, increased resilience, increased memory, increased problem solving, increased intuition and creativity, and increased job performance and achievement. Happy employees are more productive. When your employees are not happy, there's a lot of waste and energy depletion going on, right? This is a beautiful quote. The fact that we sentient and sophisticated creatures call certain feelings positive and other feelings negative is directly related to the fluidity or strain of the life process. The feelings we experience as negative are indicative of body states in which life processes struggle for balance and can even be chaotically out of control. In contrast, the feelings we experience as positive actually reflect body states in which the regulation of life processes become efficient or even optimal, free-flowing, and easy. So, thank you. And so this brings us to this depletion to renewal grid. And if you bring your attention to the left side, you've all heard of increased cortisol and all of these depleting emotions when we need to recharge, right? Anger, rage, frustration, anxiety, impatience, withdrawn, resentment, okay? And then on the right side, you see DHEA is a renewing hormone, and that is associated with the renewing emotions of enthusiasm, courage, passion, contentment, appreciation, dignity. And our energy balance, constant energy expenditures without the balance of adequate rest and recovery lead to burnout, errors, health challenges, and diminished performance. I know I can feel that this is resonating for everybody because everybody knows this is truth, right? Everybody knows this is truth. And this is huge, self-awareness. One of the most important steps in being able to stop energy drains and increase resilience is to identify unnecessary energy expenditures. So I'll say, I don't know, maybe 6 years ago or so, I did not have very good self-awareness. In fact, my husband would make me aware of it. It was great. And one of the things that would happen is I would be depleted. I'd come home from work and I'd walk into the house and I'd just start barking orders, right? And I would see the kids on their iPad and I'd be like, oh, what? They've been on their iPad all day. What? All they ate was mac and cheese, right? It would be like a hot mess. And what I realized was that my husband would be like, why don't you go and take care of yourself for a little bit and come back? And I'd be like, what? No, right? I should be able to express what I'm feeling. Come on, this is BS. And this is happening. Not nice at all. And since learning this information for me, I definitely have increased self-awareness now. Now I know that when I'm kind of snippy. Like before, like, or if I feel like snipping, I know how to pause now and be like, oh, I want to say the snippy thing. Oh, you know what? I'm probably depleted. You know what? I need to recharge myself before I come into interaction with my family. And I need to check my energy at the door before I bring that to my family. Because the energy with which I bring in to the house affects the entire rest of the evening. So, we got lots of energy leaks going on and we need to plug them up. And so when we plug them up, we are building resilience capacity. Failures of self-regulation are central to health and social problems, self-care and disease, and violence in society, which we've seen so much of, right? It's because we can't self-regulate. And from a personal standpoint of self-care and disease, of course, heart disease, diabetes, obesity, addiction. The most important strength that the majority of people need to build is the capacity to regulate their own emotions, attitudes, and behaviors. Improving physiologic coherence is an effective way to improve self-regulatory capacity. Physiologic coherence is an optimal state of mind-body balance beyond mere relaxation. So again, when we come into heart coherence, it significantly improves brain function. It increases your ability to self-regulate. You have a 40% improvement in long-term memory, 24% improvement in short-term memory, increased ability to focus, increased ability to process information, faster reaction times, higher test scores, improved ability to learn, and increased alpha wave activity in the central nervous system while in coherence. So let's see, we're at 7:07. Let's do this. If you're ready, I'm actually going to take this opportunity to walk you through an entire meditation because we're here till 7:30, right, Sharon? We're good? All right, awesome. So get relaxed wherever you are sitting. Close your eyes. I'm going to watch the time. Don't you worry about that. Relax, close your eyes, and we're going to do this a little bit, okay? And I want you to imagine your heart right in the middle, even though we know it's on the left. Just imagine your heart, and you have your right and left ventricles, and you have a nostril, like a hole in each ventricle, okay? So they're like little nostrils. And if you want to, you can even put your hands on your heart center and take a deep breath into those heart nostrils. Breathe out of your heart. Imagine your breath is flowing in and out of your heart area, breathing a little slower and deeper than usual. Find an easy rhythm that's comfortable. Breathe into your heart. Breathe out of your heart. Breathe into your heart. Breathe out of your heart. As you continue your heart-focused breathing, make a sincere attempt to experience a regenerative feeling such as appreciation or care for someone or something in your life. You can try to re-experience the feeling you have for someone you love, a pet, a special place, an accomplishment, or focus on a feeling of calm and ease. Breathe into your heart. Breathe out of your heart. Breathe into your heart, and as you breathe in, see if you can find a feeling of courage, honor, dignity, confidence, or appreciation, gratitude, kindness, care, love, compassion, tolerance, patience, enthusiasm, joy. Breathe into your heart. Breathe out of your heart. Breathe into your heart. Breathe out of your heart. Keep your eyes closed and breathe normally. And I'm going to guide you through a meditation where we're going to start by asking ourselves a few soul questions that really get us back to our authentic, true self that is love, that is light. So I'm going to silently ask 4 questions, and I want you to just repeat them silently and just let anything at all come to you. Anything, allow it all. The first question is just asking, who am I? Who am I? Allow anything at all to come to you. Second question, what do I want? What is my deepest desire? Allow anything at all to come to you in the form of a sensation, image, feeling, or thought. What is my deepest desire? Third question, what is my purpose? How can I serve myself and others? Again, allow anything at all to come to you in the form of a sensation, image, feeling, or thought. Anything at all. There's no wrong answer. How can I serve myself and others? Fourth question, what am I grateful for? What am I grateful for? Allow anything at all to come to you in the form of a sensation, image, feeling, or a thought. Anything at all. Now, keep your eyes closed and silently repeat the following sentence. I am, and your first and last name. So for me, I would silently say in my head, I am Disha Mookherjee. Now, drop your last name and silently repeat, I am, and your first name. So for me, I would silently say, I am Disha. Now, drop your first name and silently repeat, I am, I am, I am, I am, I am. And now we're going to try a little mantra that doesn't have much meaning. It's just a sound, and it's very simple. And you're silently going to repeat, so hum, so hum, so hum, so hum. You don't need to force it or concentrate on it. It's kind of like listening to it rather than actually saying it. So hum, so hum, so hum. You might notice that while you're repeating it, your thoughts are wandering to your to-do list or wondering how long this is going to take or when it's going to be over or other noises in the environment, or you might have a itch on your head. You can scratch it. Just bring your attention gently back to the so hum, kind of innocently going with the flow between your thoughts and then the so hum, so hum, so hum, so hum, so hum, so hum. Silently keep repeating it. So hum. I'm going to keep the time. Silently just do your best repeating the mantra, going back and forth, bringing your attention back when your mind drifts off. And I'll let you know when it's time to stop. Don't worry, it won't be forever. So hum, so hum, so hum. Please keep your eyes closed, and you can stop repeating the mantra and just rest. Just rest. Rest in awareness. Rest in existence. Rest in consciousness. It's all the same. And as we rest, I'm going to pronounce 4 intentions. As I say them, repeat them silently and just release them into the universe. Okay? Joyful, energetic body. Joyful, energetic body. Loving, compassionate heart. Loving, compassionate heart. Reflective, alert mind. Reflective, alert mind. And lightness of being. Lightness of being. Continue to rest. When you feel ready, you can wiggle your fingers and your toes and kind of shrug your shoulders. And you can slowly open your eyes. And if you feel called to do so, you can bring your hands to heart center and give yourself a little bow of gratitude to your soul for bringing you here today, allowing your body to recharge a little bit, recharge those batteries. Because as we recharge our batteries, we send a blast of healing light out to our cells, to all of our organs. And then from our cells, we can send out a blast of energy out to those we love, to our family, to our friends, to our neighborhood, to our city, to our state, to our country, to our continent, to every country, every continent, and every soul on this planet, and out into the universe, as we are all in coherence. We are all connected. And with this healing light, we'll say namaste. Namaste means the divine light in me sees the divine light in you. And when we see each other from that light, through that light, we're one. Some of that stuff that doesn't really matter falls away. Was that comfortable? Yeah. Awesome. So there's 5 minutes. Does anybody have any questions, or is there anything? Well, you know what, I will tell you. So I do this meditation every morning on Zoom. I've been doing it since January 1. And so it's for my my business. And so we have a heart center. I have a heart centered living group on Facebook, but then I also have a program where that leads to the path to meditation mastery. And so one of the things that I do every morning at 7 a.m. is invite people to come and join. So all of you are, of course, invited. I can give you the link somewhere. I don't know if I can type it out somewhere in here, but you're always invited to come and join us. You can get on that list. Is that okay, Sharon, if I
Absolutely. Absolutely. Yeah. I can share all that stuff. I can share the links and everything.
Okay, yeah. So it's just, you can sign up if you want more of this type of,
I see, Sarah. Mm-hmm.
Focus.
Anybody can open up the mic if they have a question, right, Disha?
Yeah, sure.
Question?
Yeah, in the last 5 minutes.
I see a lot of comments, so I love that. If anyone wants to comment verbally, we encourage you to do that.
I don't see anything, but that's cool. I hope it served.
Oh, I know it served me.
I hope that served. Because the more that we can cultivate this for ourselves, it's like the base. And from there, all those changes that we need to make in the rest of our lives to become heart-centered and heart healthy comes from a state of coherence when we're not running for our lives constantly, right? Now we can make educated, now we can make aligned decisions.
I have a question, Disha.
Yeah.
For the self-awareness and self-regulation, do you have any tips for people who are just getting started in that practice, like how to identify that? I know when I started that practice of becoming self-aware, it was tough. So is there any tips, like how to catch yourself, how to stop it, how to gain control of it?
Yeah. So, I mean, like me, my husband was the greatest teacher for me. And initially, I really resented what he was saying to me. But then I decided, you know what? Instead of reacting yet again, like the second you feel that, and I know you know what I'm talking about, that, right? It's taking that pause, right? And so this is why I'm such a big believer of cultivating a meditation practice, because yes, I'm hoping that this experience that we just had was beneficial and you could feel the calm, but the benefits of the practice actually come outside of the practice. So as I cultivated my own meditation practice, I was able to take that pause within the moment when I got the trigger, right? So instead of just like losing it, right? I was able to cultivate that space in the moment so I could respond. And so it's really about cultivating that ability to pause. And so one of the things I'll do before I even go into a patient's room, I'll put my hand on the door knob and try to center for a second, and I'll be like, all right, guide me to give this source, whoever, guide me to give this patient whatever it is that they need right now, right? And it's really living that life of intention. Like we had those 4 intentions at the end, right? And it's a practice. It's a practice for life. And so just like we gotta practice and race for the marathon, and we gotta practice healthy eating, this is one of those things that is a practice. So yeah. And what about when I'm talking about heart coherence, the quick coherence technique is literally what we did right at the beginning of the meditation, which is breathing into your heart center and just trying to get to a place, or try to remind yourself of a place, time where you had something positive, had a positive emotion going on. That's a very quick thing that you can do in the moment, in that pause. And it's okay if you don't catch it all the time, but if you have the intention, if you wake up in the morning, you set the intention, say, you know what, I'm going to pause a few times today, it will happen. It will happen.
Great. Wonderful.
Awesome. Great.
Anybody else? No? I love the heart, Sharon Phillips. Thank you so much, Disha. We appreciate you so much. And yes, I'll definitely share your resources with everyone so they can continue their own journey.
Absolutely. Awesome.
Everyone have a beautiful night. Thank you so much.
Have a great evening. Stay safe out there.